my project on alert villages in Indonesia. The program was a village-level intervention to improve obstetric service use for women who are pregnant in Indonesia by getting communities to band together to help supply resources to women that they don't have, that they would need in an emergency. Like if there was hemorrhaging or hypertensive diseases of pregnancy that created an obstetric emergency, people in the community would, for example, volunteer to allow a woman to borrow their car to take her to the hospital. The intervention spread across Indonesia over time. Between 2008 and 2011, there were huge increases in the percent of villages per province that were part of the program. And so I look at the demographic and health surveys in 2012 merged together with a village-level census called the Village Potential Surveys. So I am able to tell whether a village becomes a Desa Siaga in 2011, and then I look at villages that become part of the program and villages that are never part of the program. First, I match the villages on a set of demographic characteristics and facilities available, and then prior outcomes to get at the endogenous program placement of this village-level intervention. So after I do that, I find that villages, there was an improvement in services in villages that got the program relative to villages that didn't get the program, but the changes were insignificant and there was no change in slope over time after the program. I do this using ordinary least squares and an interrupted time series with difference in difference design. I think that why I might not have found significant results is that I only have 5 periods after the program, so it's possible that it takes longer for the program to really take effect in these villages. But what I've done is an improvement on prior evaluations that have used post-only data and then self-reported measures of exposure.